Number 10, made of stone. This one disturbs me so much and it's terrifying that it hasn't been solved yet. If you're a Game of Thrones fan, which hopefully you are, you've heard of grayscale, the disease that like poor Shireen Baratheon suffered in the series. Yeah, you know what I mean? Well, it may have been inspired by something that actually exists. Though there is a 1 in 2 million chance of getting it, it does happen. What is it exactly? Stoneman syndrome is a condition where the ligaments, tendons, muscles all slowly turn into bone. It starts with a stiffness in the neck and shoulders and then gradually moves down the body. Imagine having 2 different skeletons in your body. That's kind of what it is. What's even more heartbreaking about this mysterious disease is that you can't remove it. In fact, any attempt to remove the bone makes it grow faster and come back stronger. I hope they come up with a cure as soon as possible, as currently there isn't one as to why it's a medical mystery. But because it's so rare, it makes it even that much harder to cure it because they don't have that much on file. Anyways, let's keep going. Number 9, cyanomelia. I pretended I was a mermaid countless times as a kid, and still do every time I do a dolphin kick in the water because I'm like, I'm a mermaid. But I kinda don't want to be, and I'm kinda glad I'm not because of this. Cyanomelia is the condition in which a child is born with their legs fused together in a way that makes them look like a mermaid. Sadly, it doesn't have a happy ending, as most children born with this defect don't live very long. The 2 most famous cases are that of Tiffany Yorks, who was the oldest living survivor, living to the age of 27, and Shiloh Pepin. Patients of this condition barely survive the womb or the first few years of life due to organ issues that follow the disease. The exact cause of cyanomelia remains unknown to this day, as it appears to be a random occurrence and there's no way of predicting it. Number 8, Morgellons disease. This next one is a more controversial disease. Morgellons disease is an unexplained condition where a patient believes that there is something crawling beneath their skin. As a result, scabs and irritation erupt from persistent scratching, along with small fibers. It is controversial because the research done on the condition has yielded conflicting results. Some doctors think it is a result of a delusional infestation, while others believe it is an infectious process in the skin cells. The Center for Disease Control yielded a study that concluded it isn't caused by an infection. However, multiple studies have reported a possible link between Morgellons and another bacterial infection. To this day though, there is still no proven treatment or confirmed understanding of the disease, so for now it remains a medical mystery. Number 7, Landon Jones. It is rare for anyone to be able to resist the French fry. Everyone has that friend that says, no, I don't want McDonald's, like I don't want any. And then you order some and they always are just like, are your French fries? And you're like, get out of here, those are mine. Anyways, that would be me. Well, Landon Jones may be the only person who would be able to resist. On October 14th, 2013, the preteen Landon Jones woke up with a bacterial infection in his left lung, which was treated successfully, or so they thought. Landon lost his appetite entirely. This boy is literally never hungry. His parents have to bargain with him to eat, but unfortunately he keeps losing weight. After visiting specialist after specialist, the only thing doctors have been able to determine is that Landon may be the only one of his kind, which doesn't make it very helpful. There are no other cases like this in the world. Landon did start having absent seizures 3 years prior, which could provide some hint as to what is going on. The leading explanation is that it is a rare condition that affects the hypothalamus, the tiny area of the brain that controls hunger, thirst, blood pressure, and sleep. I wasn't able to find any recent articles referring to his progress now, but I hope, Landon, that wherever you are, that you are doing much better. Number 6, a water allergy. A human being can only survive without water for around 3 days, so this medical condition is definitely surprising. How can we be allergic to something we need to survive? The condition, while still a mystery, has a name: aquagenic urticaria, and affects less than 100 people across the world. Whenever someone with this condition comes in contact with water, they break out in hives and rashes that last around an hour, and researchers have no idea what the underlying cause is. The leading theory is that it is caused by allergens in the water, so patients are encouraged to drink purified water or bathe in purified water as well. But beyond that, they have no clue. Due to the rarity of the condition, there is very little data to study, but I think we can all be grateful it isn't common either. Number 5, Mandy Sellers. When Mandy was born, she appeared to be a healthy child until she started growing. Despite having a very lean frame, Mandy's legs alone weigh 200 pounds 5 times the normal size. She was a medical mystery doctors had no idea how to solve. The only way they could foresee stopping the growth of her legs was amputation. This procedure eventually happened in 2010 when she developed an infection. Even stranger though, this didn't stop the condition at all as the leg started growing back. Imagine how frustrating that would be. Fortunately though, according to Mandy's website, she was able to go on an experimental new drug that helped to shrink her legs. Then finally, after years of suffering, she was able to be officially diagnosed. Mandy's condition is the result of a mutation of the PIK3CA gene, the only one of its kind, something she's pretty proud of. Still, doctors have yet to come up with a more effective treatment as of 2019. She is still waiting for a new drug trial, and her legs appear to be kind of plateauing, so who knows where she's at now, but Mandy, I hope you're doing better. Number 4. Spontaneous accent. What do you mean? Nobody does that on this channel. Anyways, shut up, Rachel. God. Imagine waking up one morning and finally having the accent you've always wanted. I'm sure there is someone out there who wishes for that. But Rosemary Dorr wasn't one of them. Southern Ontario-based Rosemary Dorr immediately rushed to the hospital in 2006 after sensing signs of a stroke. She ended up spending most of that summer in post-stroke care, but what was very strange was her recovery. Rosemary took on an entirely new accent. Her Southern Ontario dialect became that of Newfoundland, and if you live in Canada, you know how different those accents are. She couldn't shake it. Rosemary was suffering from a real condition called foreign accent syndrome. It's a thing! Only 60 other cases have ever been confirmed worldwide. The first known was a Norwegian woman during World War II who started speaking with a German accent after a head injury. Very, very poor timing. The exact cause is still unknown, but you know, hopefully Rosemary's learned to live with that. It's a pretty fun accent. Number 3. The girl who cries stone. From a magic spell to a witch's curse, this little girl from Yemen shocked doctors and mystics with her strange ability. Sadia started literally crying stones since she was 8 years old and no one can sort out why. Her father was desperate to find a treatment, and despite many x-rays in local clinics, nothing out of the ordinary was spotted. Most of the stones came out in the afternoon, weirdly enough, and she can produce as many as 100 in a single day. Thankfully, they do not hurt her, and for the most part, her life is normal. Since her case, one other woman in Bajal experienced similar symptoms, except this time they were accompanied by bouts of unconsciousness and a swollen abdomen. She has since been treated and recovered fully, but as to what is wrong with Sadia, no one is quite sure. Number 2. Brooke Greenberg. Sadly, Brooke passed away at the young age of 20 before she ever found the explanation for her condition. However, there is a chance that she might never have been aware of it. Brooke's body refused to age, and at the time of her death, she had never learned to speak and had the mental capacity of a toddler and remained the size of a baby. As an actual baby, her survival was considered a miracle in itself, as she endured a stroke and several stomach ulcers. She also mysteriously had a brain tumor that put her into a deep sleep for 2 weeks. Then it disappeared and she woke up. Kinda weird, right? By age 16, she hadn't lost her baby teeth, though her bones had appeared to have aged, just not grown. Her case was enough to bring retired medical expert Richard F. Walker back to the field. In fact, he has made it his life's work to uncover what caused her condition. Her case has since been labeled Syndrome X, and he continues to study similar patients. He believes that if they solve it, they will not only help these people, but perhaps discover the key to the fountain of youth. And last but not least, a superhuman memory. If I were to have a superpower, I would either want teleportation or superhuman intelligence. I think about that every single day. So the mysterious condition that Jill Price has me like green with envy. God, oh, what I would do, the books I would read. Jill can name every single detail of every day she's ever lived. Give her a date and she could tell you everything she did with ease, from like how many stirs she stirred her coffee with to like what she read that morning, every single thing. Her condition is called HSAM, highly autobiographical memory, and why people like her seem to have this superhuman ability is a complete mystery. Brain images have depicted differences in the structure of their brains to muggles like us, but it can't be confirmed as to whether it is these brain differences that cause the condition. Oh man, but if they could patent that into like a super juice or a kind of coffee, I'd be so happy. I'd be just very, very excited about that, because good God, dreams to life, you know what I mean? Number 10, Hutchinson-Gilford progeria. HGPS is one of the rarest conditions in the world. It is a condition where the body dramatically and rapidly ages beginning as early as childhood. So it's kind of like Benjamin Button except backwards. Most of the time you can't tell at birth as they usually look normal, but as they age and grow they do not gain weight. Their facial characteristics also become thinner and fragile looking, their eyes and ears protrude, and their features like their nose and lips become thin and beak-like. The condition also causes alopecia, which is hair loss, and they lose their fat beneath their skin. However, intellectual development is uninhibited and their motor skills don't suffer either, so they're literally just trapped inside this body. But sadly, the condition does not have a very long life expectancy as they often suffer heart attacks and strokes at a very young age. There are approximately 100 documented cases where patients lived into their 20s. Currently, the cure remains a mystery. Number 9. Allergic to the cold. What? I mean, I don't like the cold, but to clarify, not a cold, but the cold. Entirely opposite to another case on this list, there are actually people in this world that are allergic to the cold. Right? Then that's not just like them like shivering in the wind. Like, I don't mean that, and I don't mean your aunt who flies to Florida for Christmas. I'm talking about breaking out in rashes. The condition is called cold urticaria. Even slight exposure can result in a welt, and jumping into cold water could result in a full anaphylactic shock. Imagine how much of a problem this is. Like, the cure still eludes doctors, but they may actually know the reason. Dr. Gerald Gleisch at the University of Utah studies patients with the condition. He says that it appears to be due to an antibody called immunoglobulin E. This antibody causes the inappropriate immune reaction and it may hold in store the cure. So far only antihistamines work a little bit, but it still remains a boggling mystery as to how things could go this wrong. You know? Very, very strange. Number 8. Kuru. I'm not gonna lie to you, I was debating putting this one on the list because it has an explanation, as some of them do on this list, but it still has no cure. Sort of. Kuru is a very strange, fatal brain disease similar to mad cow. Proteins called prions cause a buildup of abnormal brain tissue. This causes irreversible brain damage and there's just no going back. It's 100% lethal. It was first discovered in a remote region of New Guinea by a tribe that practiced consuming human flesh. Their belief was that it preserved the spirits of the dead. This little fact brings me to my next point, that Kuru can only be contracted through the consumption of human brains. The tradition to consume human bodies is now outlawed, so there have been significantly less cases. However, there remains no cure to the disease besides, like, you know, not having human brains for Sunday dinner. Number 7. Microcephaly. Microcephaly is a birth defect that affects every 1 in 800 to 5,000 babies born. There is no way to predict the condition unless diagnosed in the 3rd trimester via ultrasound, but even by then it's already too late. Even with that, the cause and treatment of the condition still remains unknown. Microcephaly is a condition in which a child's head doesn't form properly, being a few times smaller than it should be. In the womb, a baby's head grows because the brain grows. So if the brain doesn't grow, then neither does the head. Severe cases where the head is even smaller could have resulted from injury in the womb. Accompanying conditions are seizures, developmental delay, movement and balance issues, hearing loss, difficulty swallowing, and vision problems. The list of theories as to how it happens is pretty long, from genetic shifts to accidents, malnutrition, alcohol, and more, but it remains a lifelong condition with no set protocols or practices as to how to treat it, even beyond a cure. So doctors still remain baffled and there's no way of preventing it. Number 6. Tree Man syndrome. Epidermodysplasia vericiformis. That is the actual scientific name. In a previous video we talked about Stone Man syndrome. Well, this next one turns you into a living human tree. Kind of. It is shocking to look at and almost looks too remarkable to be true, but sadly it is. EV is a rare inherited form of HPV, the human papillomavirus. It causes a chronic infection of bark-like growths on the skin, and they just get insane. They usually develop on the hands and feet, but have been known to develop on the face in severe cases. Currently, there are no effective treatments besides removing the warts, but nothing can stop them from growing. A man in Jerusalem hadn't been able to use his hands for years until a doctor was finally able to successfully surgically remove them, but still, there is no cure for halting the process altogether, but hopefully the cure will follow the same one, that is for HPV, which is hopefully closer than we think it is. Number 5, the boy who never slept. Putting your child down for a nap is probably one of the most relieving parts as a parent. Yes, parenthood is a joy, but it's damn exhausting. I do not know how my mom and dad did it, honestly. But imagine having a 4-year-old who never slept. Ever. That's exactly what happened to Rhett Lamb, a young boy who boggled scientists. The mother was sure something was wrong as soon as he was born, and after realizing she wasn't just an anxious mom, theories started flying. After multiple tireless testing, finally they had an answer to the mystery. So yes, technically it's solved. I know that, but it was still a mystery and it was unsolved for a period of time. Sue me. It's really interesting. Rhett had an extremely rare condition called Chiari malformation, meaning the brain was literally being squeezed into the upper part of the spine. After undergoing surgery to remove the bone around his spinal column, doctors expected the results to set in a year later. There was a 50-50 chance that his sleep was going to improve, and it did! So I know. Okay, but this was like an episode of House. It starts out a mystery and then they solve it. Number 4, Wim Hof, aka the Iceman. Anyone who has experienced a Canadian winter wishes they had this guy's problem. Though it doesn't really sound like a problem at all, but definitely a mystery. Wim Hof isn't bothered by the cold. That's right, the cold never bothered him anyway. Over 30 years ago, Wim Hof from the Netherlands was going for a walk when he had the overwhelming impulse to see if he could swim in icy water and how it was. It made him feel so good that he's done it every day since. He has since been called the Iceman, his ability to withstand the cold superhuman. In January 1999, he traveled to the Arctic Circle to run a half marathon in his bare feet. 3 years later, he earned the Guinness Book of World Record for the longest amount of time under the ice, twice the length of an Olympic pool. Insane. He even climbed Mount Kilimanjaro in shorts. When Dr. Ken Kaemler heard of his case, he immediately began to study him. Kaemler had treated dozens of people who tried and failed to climb Mount Kilimanjaro due to the extreme cold. The only explanation he's uncovered is that it must be something to do with his mindset, or the wiring in his brain. This man defies science in ways that no one quite understands. And if you want to learn more, you can check out his website. Number 3, Perry-Romberg syndrome. Another unbelievably rare and terrifying disorder where the skin and soft tissues of half of the face atrophy. It usually occurs in the left half of the face and is more common in women than in men. The deterioration begins above the upper jaw, between the nose and the upper lip, then to the eye, ear, and neck areas. This process may also affect the gums and roof of the mouth. So essentially, the left side of your face caves in on itself and ages 80 years. Hair on that side turns white and falls out. This entire process takes place over a 2 to 10 year period before it finally stabilizes. Sometimes it hinders vision, other times the effects are just cosmetic, but still a frustrating process for the patients going through it. On top of that, there is no cure and there are no current treatments to stop the deterioration. So far, the only option is surgical intervention with reconstructive procedures. Number 2, RPI deficiency. Introducing the second rarest disease in the world, fitting for number 2, with only 4 known cases ever historically diagnosed. White matter is made up of tissue that includes nerve fibers that connect nerve cells. So, needless to say, one of the most important parts of the brain. RPI deficiency patients have diffuse white matter abnormalities, which causes psychomotor regression, developmental delays, along with seizures, poor vision, and slow emotional and physical reflexes. Scientists are working tirelessly to find a way to cure it, but you might be thinking, if it's so rare, why are we so stressed about it? Well, you might think that with your perfectly healthy brain, but to the next potential patient, a cure could mean the world. Well, actually no, it will mean the world. Though doctors have been able to figure out the cause, the cure still remains unsolved. Number 1, Field's disease. Field's disease was named after a pair of twins in Wales, Catherine and Christy, who were the first to be diagnosed with the disease, and they're the only ones. In total, there have only been 2 diagnosed cases of the disease in history, which makes it the rarest in the world. What is it exactly? Field's disease is a neuromuscular disease that affects the voluntary movement of muscles. Due to the rarity of the case, information is very limited. Doctors first noticed it when the girls were about 4 years old, and by the time they turned 9 they could barely walk. By age 11 they couldn't eat or write by themselves, and by 14 they lost the ability to speak. So as you can see, the degeneration is quite rapid. Alongside losing their ability to move and function, Catherine and Christy also experienced over 100 painful muscle spasms daily. The doctors did numerous tests to rule out other conditions, but still they have no idea what is causing the disease. Nor, of course, is there a cure. While they work to find one, the best they can do is make sure the girls are comfortable to the best of their ability. Otherwise, Field's disease remains a mystery, but hopefully not for much longer. Starting off strong with the dancing plague in number 10. The dancing plague sounds like the Harlem Shake, like it does, but it was real. It sounds like a bunch of people who just couldn't stop listening to ABBA. Oh wait, that's just me, because their new songs came out and I'm just obsessed. The dancing plague was actually a real thing that occurred in Strasbourg in July 1518. The whole phenomenon kicked off when a woman named Frau Trophia stepped into the street and began essentially doing like the twist and shout, and she did this for about a week. And then soon over 40 people joined her, all doing like the same move. A month later, 400 people were involved. For a while, local physicians blamed the hot blood and encouraged it as a way to quell the boogie nights. They even brought in professional dancers and a band. But then people started like collapsing and dying of strokes and heart attacks. So like what? Like what even is this? Like this is real. Like you're probably thinking like, Rachel, come on, we aren't that gullible. Well, Google it, baby. It is a well-documented event. The movers and shakers were eventually whisked away to a mountaintop to pray for absolution, and that cured them. I don't know why. One theory suggests that this was a result of consuming ergot, a fungus commonly found on damp rye which produces hallucinations and spasms, but there's no clear answer. People just love to dance. No idea. It's so weird, right? Like I was like, this has gotta be fake, and they were like, no, it's well documented. I'm like, okay. Sure enough, whatever, Google. I'm beginning to trust you less and less these days. Anyways, number 9. Disembarkment syndrome. Disembarkment syndrome is a very difficult condition to diagnose and even more challenging to cure. It is a strange neurological condition that follows a motion event like flying on a plane or being on a cruise ship. The patient will feel as though they are still swaying or rocking as if they're still on the craft. Symptoms vary in severity day by day, but they can also include confusion, nausea, sensitivity to light, headaches, a bobbing sensation, and could relate to stress and fatigue. Currently, there are no tests that can accurately confirm the diagnosis. Doctors usually default to it when they've ruled out all the other options, but no one knows what causes it. Dr. Yoon-hee Cha in America is the only clinical investigator of the disease, and her findings so far hint that the issue may be linked to, and I quote, hypermetabolism in a deep area of the brain called the entorhinal cortex. I probably said that wrong, sorry guys. Unquote. But that's about all we got right now, so hopefully those people can feel better very soon, but it all depends, right? Number 8. The madness of King George. Does anyone else have Jonathan Groff as King George like in The Third and Hamilton in their head? No? Just me. Okay, cool. The madness of King George is a mystery a lot of historians are determined to solve. His infamous erratic behavior has become the talking point in movies, plays, and even children's books. But what happened? Was this simply a case of an undiagnosed mental illness? Well, probably. Other theories say that he had a case of porphyria, which includes aches and blue urine. Other evidence is found in his letters. At times his writing appears succinct and direct, while others he appears to repeat himself and use more flowery language, a trait very commonly found in individuals who live with mania and depression. But as for the case of porphyria, in his medical records, it is shown doctors gave him gentian, a plant with blue flowers that could also be responsible for the blue color of his urine. Porphyria, though, is also hereditary and none of his descendants had it, so it is likely it was a mental health issue, but as to what was the official diagnosis, we can never really be sure. Number 7. Putrid finger syndrome. This one sounds gross. And it is. You're welcome. Imagine being so smelly that you could fill a banquet hall with your stench, even if you shower all the time. Poor guy. Well, that's what happened to this 29-year-old patient 5 years after he pricked his finger on a chicken bone. His finger accumulated an infection that made his body smell like really bad, specifically that arm. When he had to be examined, it was entirely intolerable for doctors to even be near him for long periods of time. Even worse, the infection couldn't be identified. No one knew what the bacteria was or how to get rid of it. They tried several treatments including ultraviolet light, but nothing worked. But thankfully for the man, the infection spontaneously cleared up and doctors have no idea how. That's pretty lucky, but if it did come from a chicken bone, then maybe we should all put Kevlar gloves on next time we chow down on some Popeyes just to be safe, because I don't want that. I do not want that. At number 6, baby brain teeth. Strange things happen while we're in the womb. It's a crazy, magical waterbed of weird stuff. Sometimes wires get crossed and accidents happen, because that's life. Doctors suspected something was up when the head of a 4-month-old baby started to grow unusually fast. They weren't so surprised to see a tumor, as that was their suspicion, but what they found inside the tumor was kind of ugh. When they scanned the brain, they saw what looked to be fully formed adult teeth inside the tumor itself. Sure enough, that's what they found. Doctors removed several fully formed teeth usually found in the lower jaw. While this isn't entirely unheard of, teeth appearing in tumors it had never happened in this kind of tumor. So as to how or why these teeth were found in this type of tumor remains a mystery, but it was probably something to do with whatever smorgasbord was going on inside the tummy. It's a weird time. Number 5, stiff person syndrome. No, this isn't referring to someone's personality, maybe, but to a condition that affects 1 to 3 people per million. Super rare. As no one is quite sure as to the possible cause, it is diagnosed through exclusion. So similar to the Disembarkment syndrome I mentioned, so they have to test a whole bunch of other things to see if this is the case. Some of the main symptoms are, of course, stiffness in the lower back and legs, followed by severe and painful spasms from sudden movement. So say for instance if they got scared, it would be like pain all through their body. Though the symptoms themselves can be treated, there is yet no way to eliminate SPS from the body. The condition can show up at any point in life with no known trigger. There are only a handful of clinics around the world that know how to help treat this condition, but due to lack of cases and study, there is still a long way to go towards a cure. Number 4, Phineas Gage. I'm sure if any one of us had a pole jabbed through our head, we wouldn't be the same after that either. But for Phineas Gage, the change was night and day. Phineas was a foreman working on the railway bed for Burlington Railroad when a sudden accidental explosion on September 13, 1848 sent a 3-foot 7-inch iron tamping bar through his head. He survived miraculously, but his personality changed drastically. Prior to the accident, he was reliable, shrewd, and capable, while after he became stubborn, rude, and loved to swear. Me too, man, but still. Entirely opposite to who he was. I mean, obviously the man lost half his brain, but his personality switch remained a mystery. Little was understood about the function of the brain, and though the accident obviously played a large role, no one quite knew how Gage could have ended up so different. Number 3, the tight seal. Sometimes when I'm on Central Dark, I wish my eyes would just seal themselves shut, because then I wouldn't be able to see anything. But when I read this story, I better be careful what I wish for. Psychological or one-of-a-kind case? Doctors are still trying to decide. After recovering from a sinus and staph infection in 2008, Natalie Adler started feeling the strangest phenomenon. For 3 days, her eyes would seal themselves shut, only to release themselves on the 3rd day with her vision entirely restored. The seal would be accompanied by neck pain and body aches. Now over 30, Natalie has to get Botox injections to keep her eyes partially open and has been declared legally blind. She still suffers blindness at least once a month, but still has no confirmed diagnosis or treatment for her condition. However, Natalie remains hopeful and plans on writing a book about her journey. Number 2, the giggle bug. We've all, hopefully, laughed so hard that we can barely speak. But for Shu Ping-Hui, she was never able to stop. Ever since she had a fever when she was just 8 months old, the now 12-year-old girl can't stop laughing. Her parents are desperate for a cure, especially after the condition worsened after she was 2 years old. She lost her ability to learn how to speak, and now can only communicate through giggles. Her father has spent all of his wages as a construction worker, but still nothing has worked. What should be a sound that brings joy to her loved ones makes makes them all the more sad. The only hope currently on the table our test specialists are conducting that include her frontal lobe. They suspect that the fever caused damage to the frontal lobe, but nothing has yet to be confirmed, so it still remains a really sad, happy mystery. Number 1, last but not least, Gloria Ramirez. I actually think this is an episode on Grey's Anatomy, but I can't remember, so just let us know in the comments if you know what I'm talking about. Right? The case of Gloria Ramirez still boggles doctors to this day. Also known as the Toxic Lady, Ramirez was sent to the emergency room in 1994 due to cervical cancer complications. Things were operating as usual until medical staff began to faint after experiencing severe shortness of breath and muscle spasms. There were also reports of an ammonia-like smell coming from her blood. Sadly, Ramirez died after kidney failure, but meanwhile 23 people fell incredibly ill, along with 5 who became hospitalized themselves. Every single one of them had come in contact with Ramirez. What's even more terrifying is that there was no explanation for the issues. Doctors defaulted onto mass hysteria, but there was no explanation beyond that. Officials conducted 3 autopsies on the body, which led to the conclusion that a product called DMSO cream might have caused it, but as for the other aspects, no one is quite sure.